So first things first, I just want to set the stage because we always seem to talk about postpartum depression. Postpartum is everywhere. And it's very important, I think, to turn back the clock and to really start talking about depression and mental illness during pregnancy, and even ideally before pregnancy, to help people set up a plan as to what their risks are, what their risk factors are, and what their treatments may be. It used to be thought of that pregnancy was a time when women were just glowing and thrilled to be pregnant and everything was wonderful and any other problems they might have had would go away. We know that's not true. And we know that the risks of mental illness and depression and anxiety are actually very high during pregnancy, and the same as in the non-pregnant person. So that myth really doesn't hold true. And what I am always emphasizing in speaking with different groups and who come across people who are pregnant is that it's really something that's under-recognized, under-diagnosed, and unfortunately under-treated with significant implications, which I'm going to get into later. And because of many issues around stigma of mental illness during pregnancy, the shame and that people feel by, number one, having a mental illness, number two, having it at a time when they're supposed to be glowing and happy, really puts people in silence and isolates them. They often encounter challenging reactions from healthcare providers if they're struggling during pregnancy. So really important to be aware and to be talking about this, as I'm going to get into in my presentation. Also, as I mentioned, we do talk about postpartum issues a great deal, and we know that 40% or so of postpartum depressions actually have begun during pregnancy. And so really important to identify early and to be aware of these issues during pregnancy as well as postpartum. I know this is a very wordy slide, but I'm going to give you a second to take a look at it and to read through some of it. And my point of including this slide is to really drive home the fact that for mental illness, and in particular depression in this case, there are both psychological as well as physical manifestations of the illnesses. So I'll give you a second to take a look at it. So under the column of the psychological symptoms, it's quite obvious a depressed mood, feelings of sadness often, but not always, can be experienced, and people often don't know what depressed mood means. And very commonly, depression in pregnancy and postpartum is accompanied with a lot of anxiety and a lot of intense worries about, have I eaten the wrong thing? Have I used the wrong skin cream? Have I been exposed to too much pollution in the air? Those are common things that people tend to worry about in a very significant way if they're struggling. Lack of pleasure in life, lack of excitement about the baby coming or getting ready for the baby is common. People commonly withdraw socially from their family, from their friends, and very, very, very commonly, and those of you who are all parents right now, and many of you who obviously care for women who are pregnant know that guilt is a very common part of motherhood, probably, or parenthood. And when someone is struggling with depression, guilt gets blown out of the water. People worry that they're not eating the right things, that they're not drinking the right things, that they're being exposed to the wrong things. As I mentioned, there's a lot of guilt. And then there's the double layer of guilt about having mental health symptoms and mental illness at the time of pregnancy. And this guilt can be debilitating for people. There's also strong feelings of hopelessness, worthlessness that will accompany people. And in the more serious cases, people contemplate suicide and think about harming themselves or ending their lives if the illness persists for too long. The physical symptoms of depression are usually a little bit less reliable during pregnancy because there's so many confounding factors in a person's body when they are pregnant, such as sleep changes already, appetite changes, weight changes. So we focus a little bit less on some of these, but they're important to know about. In addition, cognitive function might wane, and in terms of concentration, in terms of memory, and people might feel more sort of tired and lethargic than they otherwise would. And psychomotor disturbances means that people feel super slowed down, or they might feel very on edge and agitated, more so than you'd expect in a pregnancy of someone who's not struggling. So I'm just putting all those symptoms out there to keep in your mind as I go through this presentation. One of the really controversial topics, surprisingly still, is actually screening recommendations during pregnancy. There have been some recent guidelines from various organizations, including the RN Association of Ontario, in terms of recommending screening. And I'd probably tell you that most best practices now do include some type of screening process. And the benefits of that are that you can catch it early, and screening can, and there's still a lot of controversy in terms of the timing. Should it happen during pregnancy? Should it happen postpartum? The frequency, how frequently should we be re-asking these questions? But it is clear that some type of screening process is very important and very helpful for identifying people, for getting them the help that they need, or at least identifying them as possibly at risk, for getting the impact that the actual mental illness will have on the individual themselves who's pregnant, on their partner, on their family. Very important to intervene with screening in this way. In ideal settings, it's really helpful to follow up with the client over multiple time periods during pregnancy as well as postpartum, and to have access to a care pathway. I know that's not possible or doesn't exist in many jurisdictions, or is a challenge in many jurisdictions, but that's the ideal scenario, is to, once someone is identified, is to initiate care at that point. One of the most common and most well-validated tools that we use for screening is called the Edinburgh Postnatal Depression Scale. And you've probably heard of this. We commonly call it the EPDS. The reason it's the most common and most recommended is it's short. It's only 10 questions. Clients or patients